That's always interesting. All right, good evening, everybody. My name is Omari Salisbury. Welcome to the Coronavirus Update Show. As usual, I'm joined by producer extraordinaire and these days mathematician and all kinds of whatever else you be doing with these numbers. Producer Nikki Barron, how are you?
I'm good. I'm good. Relaxing a little bit tonight. Yeah, just this wasn't as scary of a show prep, so there's a little scary section, but the rest of it's pretty much good news. So yeah, it was a good show prep for tonight. So feeling pretty good. Feeling pretty
Got,
relaxed.
got good news for us, huh?
Yeah, I think some of it. Yeah,
Kind of,
I
sort
think
of.
it's all good news, but the topic itself, even the best news in this topic can be a little hard sometimes.
This is true. All right. Well, as usual, let's get right into it and go into the
Yeah.
numbers.
Let's kick it off with our numbers. So, another 1,825 coronavirus cases and 44 deaths have been reported in Washington state, bringing the total number of diagnoses to 305,289, including 4,211 hospitalizations. Statewide, we are at 81% hospital ICU inventory and a 10% positivity rate. And we just broke another record today. We surpassed 100 million cases worldwide with 2.16 million deaths, with 25.5 million of those cases in the United States and 425,000 of those deaths here in the United States as well. So we've officially surpassed the number of lives lost in World War II. And yeah, we're just over half of the amount of lives that we've lost compared to the Civil War, which is the deadliest war in American history. So, in that case, that was the scary part of the show. That was the worst part. But I feel like it
So,
helps to give context around deaths, because when you say 2.16 million deaths, that number is just so big. I think it's hard to understand the gravity of the situation. So I've been trying to find examples that we can compare it to so people can understand like how unprecedented the lives lost really is.
yeah, I think unfortunately sometimes people might be able to imagine it, but because it's I don't know, it's just the way the news cycle is and things. It's like, oh, okay, you know, it's man, that's a lot of people.
Yeah.
That's wow, good God. All right, well, so taking things on the national front, we got a new president, and this guy sounded like he's pretty ambitious around COVID and COVID response and wants to stay very focused there. Signed a lot of executive orders and things like that. And it looks like one of the first things he wants to do is actually take control of the private sector and have the private sector jump on board on this on the fight to stop COVID.
Yeah, so the Biden Harris administration announced in a 200-page document, actually, that a bit of measures that they're going through. And the first one is the use of the Defense Production Act. And that's actually going to allow us to increase our vaccination supply by about 16%. So, right now, speeding up the rate of vaccination is currently really our only path forward in terms of getting the country reopened. And so, with that announcement on Tuesday, we'll be able to increase the supply and hopefully meet all the markers and benchmarks that they've put out there, which they would say would be success. So, our goal is to try to get that herd immunity by fall of this year. So, this is definitely going to help us accomplish that goal. And yeah, so let's see. I had a quote here I wanted to read. So I'm going to read it off the screen. So, first, after review of the current vaccine supply and manufacturing plants, I can announce that we will increase overall weekly vaccination distributions to states, tribes, and territories from 8.6 million doses to a minimum of 10 million doses, President Biden said on Tuesday. So, yeah, it's one of the major bottlenecks for vaccination rollout is that we just don't have enough vaccines to go around. And so we're having to do things in these phases. So it's going to be really good news for us that we're going to be able to increase that number.
All right, all right. And it turns out that the syringes. This is man. This is just it's one of the things. It's just an issue everywhere. But it turns out that a regular syringe has space too much space in it, and some vaccine gets wasted? How does this work?
Yeah, so if healthcare providers utilize what's known as a low dead space syringe, it would allow vaccinations to be increased by 20% because we'd be able to extract a sixth dose from the vial. So the US Center for Disease Control and Prevention has actually begun giving healthcare providers packaging that includes both types of syringes. So 3 syringes that are your traditional volume, and then 3 that are these dead space volume syringes, so that we can extract that additional dose. And really the reason that we have to do this like sort of like half syringe, half this kind of syringe and half that kind of syringe, is because that low dose syringe is not actually mass manufactured at the same scale. It takes specialty manufacturing. And so even with people ramping up the production, I think they're projecting an additional billion syringes. We're still not going to be able to produce enough of these low dose syringes to fully take advantage of every 6th dose that's out there. But this will definitely increase the amount of vaccines that we can get in every vial.
Right, right. And so clearly they need to buy more vaccines. I don't know how much they're paying for these, but you've got to buy hundreds of millions of these things. What's the plan on that?
Yeah, so I think they are, I might get these numbers wrong or switched, but I think it's Moderna's vaccine is $19.75 for a vial, which has, in theory, 6 doses. And then the Pfizer is 15. Those might be swapped. I might have those swapped, but those are the prices between $15 and $20 for a vial, just for reference. But so utilizing some options that were actually built into the vaccination contracts that were put in place during the Trump administration, the Biden-Harris administration has been able to negotiate an additional 200 million doses between Moderna and Pfizer that should be delivered in full by the end of the summer. So this is going to push us to 600 million doses available, which is about a 50% increase to what we have negotiated currently. And that should be enough to vaccinate about 300 million people. The only thing is that currently with the phases that we're in nationwide, there's already 260 million people who are eligible. So even at the end of the summer, with this increased purchase from Moderna and Pfizer, we're still going to be just 40 million over the current people who are able to get their vaccine right now. So we'll see what happens. I think we're going to need to get a lot more than this when it comes down to it, but this is good news.
Yeah, I heard something today. I watched one of these press conferences. They were talking about that maybe since there's these manufacturers that are out there, these pharmaceutical companies, that it would be uh, Johnson and Johnson might make the Moderna vaccine at their facility, or vice versa, because it's like who might have capacity to be able to get it out. So even if it's not their vaccine, if they already have the labs and everything else, the factory, so to speak, to produce another company's vaccine. This would be interesting, especially when you talk about that Defense Production Act, how that rolls out. Heard that they're calling out FEMA, and you got a lot of 10,000 or something like that FEMA employees.
Yeah, so the FEMA, or the Federal Emergency Management Agency, will be using federal funding to accelerate the state's current vaccination efforts by identifying and filling gaps, as well as establishing all brand new vaccination centers on top of that. So the way that they did that is they started up something that's called the Interagency Vaccination Task Force, and it sits inside the FEMA's National Response Coordination Center. And basically what they're going to start with is they're going to start by providing financial reimbursement to the states for the money that they've used to get the National Guard to help respond to COVID-19. They're also going to reimburse the states on things like the cost of PPE, the cost of overtime pay for people training, as well as hiring additional staffing. And they'll also be actually reimbursing states for costs associated with reopening schools, childcare facilities, non-congregate shelters, domestic violence shelters, and our transit systems. So they're pretty much starting by reimbursing and kind of flowing FEMA's money into the systems that are already in place before adding additional vaccination centers.
All right. And is this now? Sure, you could be on this stuff, man. I mean, it's
Yeah.
great how much preparation. We were just talking about that before the show. It's great how much preparation that you put in to every single coronavirus update. There's no winging it for you.
I don't really like, I would hate to give somebody false information about something that's just so important. And I know that there's so much information flying around. I want to make sure that I can process it and then, you know, re-teach it out there in a way that's easy to digest. And so it does take me reading, I probably spend like 6 hours reading and preparing for every episode just so I know that I fully understand every aspect of what I'm talking about. Because it's really important. The stuff is super scary and knowledge is power.
Right. Well, I know that all of our viewers appreciate it, just like I do. I saw something interesting today too, and it was like that the vaccine, basically, now they're saying that blacks and Hispanics are dying at 3 times the rate, and then
Mhm.
also that the vaccine for most of the people that are getting it is like it's mad crazy disproportionate. That, like, you know what I'm saying, like black people, Hispanics are like a very low number as far as even where it's being distributed, access to it, and some of everything else. And I know that they were talking about trying to, like, equity goals of this and that to get the vaccine out there. Also, you see that just on a side note, there's a Seattle hospital here who had a private stash just for their rich donors. But I guess Governor Inslee's office called him and was like, "Man, come on, what are you doing? You know what I'm saying? You can't just have a
Yeah.
private stash for your rich donors." But there's a lot of inequities, even around this vaccine, or especially around the vaccine.
Yeah, so they've taken that into account with these executive orders, and they have three major ones that they're kind of using to combat that. And the first one is that they're going to create 100 community vaccination clinics to accelerate this immunization effort for all Americans. And they're prioritizing people who are in remote areas and areas who are being highly impacted by the virus. So the way they're going to kind of structure that is that the experts are saying that they're going to have to set up these mega vaccination clinics. We saw an example of that this past weekend when Amazon distributed 2,000 vaccinations on behalf of the state of Washington at their headquarters here. We're going to see a lot more of that. We're going to see a lot more community clinics popping up inside of churches and well-established community centers. We're also going to see those mobile clinics that are going to go out to try to reach those people who don't have community centers. They may not even have more than a gas station in their town kind of situation. And so they're going to be providing funding as well as infrastructure to roll out those 100 community clinics. And that's going to be something that FEMA does. The next step that they're taking to help get these vaccines out to people, especially, in our BIPOC community, is they're going to supply more directly to the pharmacies. And so right now we have about 40,000 pharmacies that are enrolled to participate in this program. And the Biden-Harris administration is preparing to send vaccines directly to these pharmacies starting as early as February as part of our national vaccination strategy. And so the reason they want to do that is because right now they go to the state, and then the state decides how that gets distributed out to the pharmacies. And so they want to kind of cut out that middleman so that we can speed up the vaccination rate, because a lot of people who maybe aren't going to go to a hospital or to a one of these mega vaccination clinics, they might be very familiar with their pharmacist. They get their flu shot every year. They get their booster shots there. So they're hoping that having that familiarity between the pharmacy and the community can help maybe pull in some people who might be vaccination hesitant.
Yeah, well, I mean, they definitely got to work on that. It's just tough in a sense. Like, even if black people were clamoring for the vaccine, in a lot of places in America they are. Like, I'm down here, I'm down in North Carolina right now, and especially the elder population. They're like, yeah, they're looking for the vaccine. Just the way that it was initially rolled out, like, so even if there were like claiming like, oh, we want the vaccine, it's still like, yeah, no access. So, I mean,
Yeah.
we'll see what happens. It's good to see that Biden is on it. And watching these pressers today, he stayed out of the way. Didn't see him at any of really of these press conferences with Fauci and them. They were doing their thing, and they were saying that that's basically his management style, at least around COVID, is he's going to let the experts take the lead. Let's see, let's see what happens.
Yeah, I recently listened to an interview on the New York Times Daily podcast, and they did an interview with Fauci about what it was like to work for the Trump administration. And, I didn't know this, but he was getting death threats. He had somebody send fake, like, white powder to his home to scare him. People were following his children and his wife to their jobs. Like, he was just he was told that they called him, it was really sad, they called him the skunk at the picnic, because when everybody was like, can't you just be positive, why are you just talking about the dangers, like, let's talk about something nice, he was like, sort of like, I don't really have anything nice to say because this is a global pandemic. And
Right.
so he was kind of contrasting that to what it's like to now work for the Biden-Harris administration, and they're very the opposite. They want to hear all the bad news as long as it's the truth, and they want to help get that out there, and they really lean on him as an expert. So I'm glad he didn't quit, and I'm glad he powered through, and I'm glad he was the skunk in the picnic, because sometimes you need that person to shake everybody and say, hey, don't forget, this is really bad.
We always need people to tell the truth.
Yeah.
Especially when you don't want to hear it. All right. Well, I think this is it for the coronavirus
Oh, wait,
update
we have
show for
one
this. Oh,
more
really?
executive
Good
order
stuff.
that I didn't hit.
Well,
Yeah,
let's
so
get
this
hit
one
it.
I think is really great, and it's a stark contrast of what we were seeing in the Trump administration. So the Biden-Harris administration has announced they are establishing a health equity task force to provide recommendations for allocating resources and funding to the communities that have the inequities for COVID-19 outcomes. So this task force is going to start increasing the amount of equity data that we have to help make decisions about how we distribute the vaccine. And it's also going to help with how we distribute our funding for PPE, for testing, for known therapies that work to help decrease the symptoms of COVID. So I think this is really, really important. And I'm really excited to see something like this get rolled out, because I know we have this in King County and in Washington. We have a lot of this data that we collect, but it's easy to forget that the rest of the country doesn't have such a forward leaning, especially when it comes to racial equity, government. So I'm really glad to see that we're going to now have a national approach to this, so that we are prioritizing these communities.
All right. Yeah, that is good news. I'm glad that you got that in there. It's needed, you know?
It's so important, because we all know this in Seattle, that it's, essential workers, frontline workers are our majority BIPOC community, and they're the ones getting sick at higher rates because they're
Dying at a higher rate, too.
and dying at a higher rate because they're at work getting COVID, while the white community and the wealthier community is getting it from gathering for things like Christmas and New Year's, and not wearing masks and stuff like that. So that inequity is so important to shine a light on, and not just in King County, but we need to be shining that light nationwide, because it's an important conversation.
Good stuff. All right. So what I was saying is this is the last episode for this week of the coronavirus update show. And of course we'll see you tomorrow morning on the morning update show. I mean, you are just a dynamo at getting out this information to the community. And I just want to take a second here to continue to acknowledge, the morning update show and all these other shows have grown out from that. Now, one way or another, it's about 13 different shows that we have, which is crazy. Started from the morning update show, and we started that show specifically just to be able to give COVID information to our elders and people in our community. And I gotta tell you that I'm so proud to like go out into the community and say and that like this is a mission that we've continued and even enhanced, because now we even have somebody. Before it was like us, headlines, oh, you should go do this and that, but the fact that we have somebody who every day comes on the morning update show and can tell people in our community what's going on and what's happening, and we've got a special show 2 days a week. I just really want to acknowledge you and man, tell you, man, thank you. And we're so proud of you and what you've been doing and your commitment to the community.
Thank you. I appreciate that. I love the work, and I feel like somebody has to do this work, and I can bear it, so I will. So I'm proud to do the work, and I'm proud of all the shows we've spun out of the morning update. You and I have a hand in every show that goes on the air, and so they're all like my little. I have like 13 little babies.
Hands full.
My hands are very full, and some shows get more attention than others, which I hope is not the case when you have kids. I don't have any kids, so I wouldn't know. So these are my 13 little babies, but this one is my first.
And you're doing a great job. So
Thank
we'll
you.
we'll catch you everybody tomorrow, 11 a.m. And we're actually getting ready to get out of here a little bit early today because it's 7 o'clock. We have a primetime special with Trey Holiday, and she's talking to Ashley McGirt, the therapist Ashley McGirt, about suicide and mental health in the Black community. So we'll get out of here for that. And until next time, peace out. We gone. Bye.
Peace.